or good evening, everyone. My name is Amy Stevenson. I use she, her, and I am the Caregiver Wellness Coordinator at the Scarborough Center for Healthy Communities. We offer education and support to caregivers through sessions like this, social work supported counseling, and I'm so happy to have you join us today for a great session on support for working caregivers. Now, we have some great expertise today from the Ontario Caregiving Organization. And we're going to dive a little bit more about what the OCO is and what they provide. But I'm happy to present our two speakers. So we have Sharid, who is a full-time dad of two troublemakers, one who is 5 and a year and a half old. His favorite activity is listening to his kids say things to people that he wouldn't dream of saying out loud. In his spare time, he is the regional lead for the community engagement for the Central Ontario region, including the GTA, at the Ontario Caregiver Organization. He has worked for over 7 years, he has over 7 years of experience in Canada in stakeholder and community engagement and co-design work. He holds a master's in public health degree and has worked in global health initiatives in developing countries prior to him and his family immigrating to Canada. He's also joined by Felicia. Felicia is the program and service lead for workplace and helpline at OCO. She has worked in the social service and not-for-profit sector for 14 years, focused on program development and implementation. Felicia's goal is to ensure all people of all abilities can live well in their communities and have access to the support that they need. As a caregiver, she understands the challenges of balancing career and caregiving priorities, all of which helps to inform her work at the OCO. So as we can hear, we've got some expert speakers today that I'm happy to hand the mic over to.
Hello, everyone. Again, my name is Fred. I'm happy to be here today. Felicia and me are coming to you from the Ontario Caregiver Organization, and we'll go over who we are, what we do, and specifically do a little bit of a deeper dive around what supports we have in place for the working caregiver. So the focus for today's session is going to center around learning more about the caregiving experience, exploring strategies for balancing work and caregiving, and reviewing resources and support options that might be that might benefit you. So much of the content that comes from the work and for today's presentation comes from the Work and Caregiving Balancing Toolkit, which you can download for free through our website. And we will make sure that if anything we share today is available to you, we will email it to Amy and she can send it out to you after as a resource list as well. So next slide, please. Let's start with who we are. So the Ontario Caregiver Organization is a relatively new organization. We've been around for about 4 years. We were established in the spring of 2018, and we're an independent nonprofit agency that is funded by the Ontario Ministry of Health, and we are accountable to the Ontario Ministry of Health. The organization was established after there were a lot of consultations that were done by caregivers with caregivers, and in order to inform the BEAD report, which built on work that was being done by the Change Foundation. The Change Foundation at that time, before OCO existed, did a lot of the work around caregivers' well-being, and also was within that space. But much of that work has been transferred over to us, and we OCO do that work at this time. We work with caregivers regardless of where they're coming from throughout the province, regardless of their age and regardless of what the diagnosis might be. And we aim to be that one-stop shop for information and supports for caregivers, regardless where they're coming from. So next slide, please. About the Ontario Caregiver Organization. So this diagram shows you the different aspects of the work that is being done by OCO. And as you can see, at the center of our work are the caregivers. We draw from consultations from caregivers and feedback from caregivers around what they're experiencing wherever they may be located throughout the province. And based on that, through our advisory panel, our working groups, or our feedback platform, we tailor our content, our resources, and our programming to fit those needs and gaps. And we also collaborate with caregivers and with other stakeholders and different agencies in making sure that we have partnerships throughout the province so that if a caregiver does reach out to us, we're able to offer services in-house, but also direct them to subject matter experts based on where they're coming from as well. So let's, next slide, please. Let's firstly define who are Ontario's caregivers. So we at OCO define family caregivers as any family member, friends, or neighbors who are providing care for another person, for the care recipient, in an unpaid capacity. And this could be due to a range of reasons from what you can see on the screen. It may be due to illness, long-term illness. It could be a palliative condition. It could be an old age related disorder, anything for that matter. So as I mentioned earlier, we work with anyone who identifies as a caregiver, regardless of where they're coming from the province, regardless of their age, and regardless of the medical diagnosis. When we're looking at numbers, we know that there are about 4 million caregivers across the province, and this includes young caregivers. And we have a program for young caregivers called the Young Caregiver Connect, which I will talk about a little bit down the line during the presentation. When we're looking at their age demographics, we see that a large percentage of them are between the age of 36 and 65, who also identify as being part of the sandwich generation. That means they're taking care of someone who's older to them while also having responsibilities towards younger individuals as well. We have 54% of caregivers who identify as female, 45% as male, and 1% as non-binary. And 69%, so almost 70% of caregivers are employed. A large part of what we are going to talk about today are around the challenges that these employed caregivers are facing in the province. So when we're looking at who they're caring for, so most caregivers are taking care of about one person, but about 1 in 5 are taking care of more than one person. So these are likely to be individuals who fall within that sandwich generation and are likely to be taking care of a parent as well as raising young children. The sandwich generation makes up the biggest group of caregivers across the province. About half of caregivers, so 50% of caregivers, say that their top responsibility is providing emotional support to the care recipient. And other responsibilities may include things like offering behavioral supports, such as responsive behaviors, providing physical support, such as lifting, moving, providing basic medical tasks, such as administering medications. But now lately we've seen they're also involved in some complex medical treatments, complex medical tasks, such as changing G-tubes or administering injections or changing wound packages, right? So especially during the pandemic, we've seen that because people are staying home and the care recipients are staying home, they're having to take on a lot of those responsibilities as well as a lot of them providing some personal care, such as bathing, changing incontinence products, etc. So caregiving throughout the pandemic has caused many challenges, and it has impacted the lives of caregivers through all of these different aspects. So it has impacted their time, it has impacted their finances. We know that caregivers have said that the pandemic has really caused a dent on their financial lives. It has impacted their health and wellness, their physical as well as their mental health. It has affected their relationships. We have had caregivers who've said that the relationship dynamic has changed because of the pandemic, where earlier maybe they identified more as a partner or a son or a daughter or a father or a husband or wife. Some caregivers have gone as far as saying that now I see myself more as a personal support worker or a nurse because I'm doing all of these activities that normally I wouldn't be doing. But we are going to be concentrating a lot of our content today around the employment and work-life balance. But when we're looking at the numbers for COVID-19, next slide, please, we see that most of these numbers have increased over the past year. So when we're doing a comparison between 2020 and 2021, we see that a lot of caregivers, 61% of caregivers find caregiving stressful. You can find all of these numbers and more information around caregiver profiles through our Spotlight report that we do on a yearly basis. That's available through the link that's on the slide right there. And I know that we'll be sending these slides out to Amy for you to circulate with everyone else as well. And I'm going to pass it on to Felicia.
Thank you so much, Shred, for starting us off. And hello, everyone. It's great to be here today. Thank you for joining us. So now we're going to start looking more into the details around strategies and tips that we can start to put into place as we are balancing work and caregiving. But Shrid just gave us a really nice overview of what caregivers are telling us across Ontario, how they're feeling, what they're having trouble coping with, gave you some really good stats on exactly how that's broken down across the province when we talk about the 4 million caregivers. And you might have noticed that the group that we have the most caregivers, that sandwich generation, many of them are still in the workplace and planning to stay in the workplace for many more years to come, right? So definitely we know that a lot of caregivers are impacted by this balancing act. But I'd like to start us off just kind of thinking about what caregiving experience can do in the workplace as well. We do have a number of caregivers who have worked alongside us as we've built out resources and information for balancing work and care. And one caregiver named Carrie was a part of all of this in the early days. And she shared this with us and just really bringing to light the fact that caregiving experiences really teach us about resilience, which means that we can adapt really well to many different types of situations, including in the workplace. And we also learn how to be flexible, how to have really good judgment, be able to make changes and decisions on the fly because you never know what's going to happen day to day. And so that really gives us a lot of perspective and insight and wisdom that we can bring into our work as well. One thing that I've heard from caregivers over the last few years is that even when they're going back into the workplace, perhaps they took some time off, or maybe they're just coming out of training or out of school, and they have all this rich caregiving experience, but they don't always know how to demonstrate how that's going to make them that much stronger of a coworker, of an employee. And so I think it's really good for us to be reminded of that as well. So if you're sitting here right now, a few of you did answer the poll to say that you are currently working and you're having a hard time balancing. What I really want you to take away from today is that you are not alone. When you're a caregiver and you're working, it is like juggling two full-time jobs at once for a lot of the days. And when we've been doing our spotlight reports and a number of other from other research outcomes, what we've learned is that 35% of the workforce across Canada is actually caring for someone with a physical or mental health need. That is a very large portion of our workforce. And if you think about that, if you're currently working and you think about the number of people you have in your workplace, 35% of them could be caregivers, or they will have a caregiving duties in the future. What we also know is that out of those who are balancing both worlds, almost half of them are saying, I am really finding this stressful, and I don't always have the answers as to how to balance this. And 1 in 3 are actually worried about losing their job. So this year, that stat went up. We noticed that more people are worried about losing their job, especially coming out of the pandemic. Some workplaces, it depends on the sector that you work in, some of them were able to offer some flexible options because of the pandemic, right? A lot of places didn't have a choice. And now a lot of people are worried about going back into the workforce. What does this actually mean if I have to be somewhere physically? I found some ways to make things work at home. So they're worried about that and risk of infection. Others are saying, you know, I don't mind being able to go into a physical workplace because home is very stressful for me. So we're seeing, you know, across the board, some differences in opinion in regard to what that's going to look like over the next coming years as we hopefully make our way through this pandemic. I think one thing to start with, and I know this can be hard for some people because you're very busy, you're always running to the next appointment, the next phone call, taking care of something around the home, but we really need to be easy on ourselves because you can't always do it all. We're all human beings, and sometimes you need to stop and think about what you need in that moment. So what we like to do for part of our strategy development here is before we even look at the workplace, let's think about managing your support role in your personal life. So how can you start to break down some of the tasks and the duties that you have every day in your caregiving role to see where there could be room for some opportunities for people to come in and assist? Can you build your own care team? So thinking about who you need for you, whether that's someone in the professional world, medical or therapeutic. You have to identify some areas that you're really struggling with. Maybe it could be something like getting to the groceries or getting the house tidied up because there's so many other things that are happening. Those are some of the things you could be struggling with. And then also looking into some services and support. And later in the session, Shred and I will be going over all the options that we have, as well as how you can find some supports in your community as well. So the first step is to really think about what this looks like for you in your personal life. So you are used to being the person that supports everybody. You are the helper, you are the caregiver, right? So sometimes it can be hard to take a step back and say, well, who's on my team? And there's really two main groups that we can look at. Those providers, like I mentioned before, that could even include someone like a pharmacist, physiotherapist, a nurse, maybe the PSW that comes in. And then natural support too. So thinking about any family, friends, and neighbors that you trust and you have close to you in your life. There's a lot of really well-meaning people out there. And I'm sure if you're a caregiver, you've probably heard the sentence, if you need anything, let me know. The hard thing about that, people are really well-meaning when they say that, but the hard thing to do is to then stop and say, well, what can I suggest they help me with? And that's a lot of work in itself to even think about what they could assist you with, right? So sometimes breaking down what we need and all the different tasks in our day can help us come up with a few little things that we may be able to go back to those people with and say, you mentioned that you'd be willing to help. This is what I need right now. So once we kind of think about how we can make some changes at home, who we can bring in to support, now it's time to start thinking about the workplace. So if you're currently at work or you're hoping to be going into the workforce, whatever that looks like for you, we've developed the Working Caregiving and Balancing Act Toolkit for working caregivers. Now, this was created alongside working caregivers, employers, as well as the Canadian Mental Health Association. And what we wanted to do was look at everything a working caregiver could be finding challenging, all the different needs that are coming through for them, and then break down some really key steps on how you can make some changes in your workplace, regardless of sector. And so these are the 5 main steps that we're going to work through today to build out some of those key strategies. And in our toolkit, this is all laid out with more information as well as templates that you can use in order to work through all of this. Because sometimes you just need to get it down on paper or fill in that PDF online to start really getting an understanding for yourself about what your options are. So the first step is doing your research, right? So unfortunately, we do have to take this step. And I know everybody's busy and it's one of those things you just don't always get to, right? But you have to understand what your options are. You need to know, okay, in your actual workplace, what are the HR policies and procedures that are there to support you? Are there any? Is there something there around family support or extra days off for caregiving duties, right? It may not be listed as that in the HR manual, but there could be some services there or some supports there that you can lean on as a starting point. You also want to see, okay, based on what I need and what I'm having a hard time with right now, what's available in my community to assist me? You may have been very focused on the person that you care for and making sure all their needs are met. So now it's time to think about what your needs are and what services you might need. There are also financial resources and benefits out there. Some of them are through the government. Some of them are through private providers. We do update that information on our website whenever options come up. So there could be caregiving leaves or some other benefits that you might want to look into, tax credits, things along those lines. And then there's benefit packages for some employers. I know not everyone gets benefits, not everyone even gets paid sick days, but there can be like EAP programs, so employee assistance programs, things along those lines that you can dip into. And really also think about what flexible working arrangements are out there in regards to being able to leave the workplace for a certain amount of time to take care of some caregiving duties. There could be supports there, or even looking at flexibility within your workplace. They could have things like job sharing opportunities, splitting shifts, things along those lines. So once you get a good sense of all that, you may then feel ready to talk to your employer and you share what you're comfortable sharing. You don't have to share every detail, but at that point, you kind of know what's available to you. You also want to be able to take some time to really assess and make some decisions. And so once you, like I said, have done that homework and get a good sense of what's out there, what's available, you could use a tip sheet like this that we have in our toolkit to then go through, okay, well, do I want to look at some flexible hours? Is that what I want to ask for? Is there some ability to change shifts sometimes? Again, it depends on the work that you do. We also talked about the different leave options. Sometimes it might even just be an opportunity to access a personal space within the workplace to be able to take a phone call on the fly, or quickly make some arrangements with someone else, right? So there's a number of different things that you want to think about. What's really going to be helpful for me? What do I want to ask for? So then the next step is to start thinking about your discussion. Many people tell me when I do these sessions, I am not comfortable talking about this in the workplace. But once you kind of get some information behind you and you work out some ideas, this could be a good time to go to your manager and really start talking through some of the options. So employers actually helped us build this list of tips here, because we went to employers and we said, what would be helpful if an employee came to you who was in this situation? What do they need to do? And so this is what they came back with. They suggested you book a time, really think through your message and the options that you want to be considered. You want to be open, be patient, because sometimes it can take time to set these things up. They're also asking that you really do consider both sides, right? So if you think about the needs within your job, and then you're thinking about your own needs within your work as well as at home, then you'll be able to start to see, are there some risks with my ideas? Could there be other opportunities? So just really being open to having that discussion, and also maybe some new ideas that could come from your employer as well. They also suggest that you follow up in writing afterwards. So if you have a discussion, maybe some things are left undecided, maybe you did decide some things, you want to be able to follow up over in writing or over email. So after that conversation, normally something is determined, right? Either you're not going to get what you were looking for. Maybe there's another option on the table now with the employer. Maybe they say, I got to come back to you with this. I got to think this through too to find the best solution. Or maybe you did get what you asked for, right? So maybe some of those flexible options are on the table. That's been confirmed. That's been planned out with your manager, with the leadership team. You may also have some coworkers that you really trust and rely on, and maybe you say, my responsibilities are changing on our team, and this is what it's going to look like, right? So that can be something that you do together as a team. What a lot of people find helpful at this stage is really working through some key responsibilities. So sometimes caregivers will do this before they go into that first meeting, along with some ideas that they have on those flexible options. Other times, once things are decided along with their manager, then they put that into a work plan. So again, it's another template that you can use. So whatever it is that was decided, you should definitely get it in writing. It should be approved and signed by your manager, and also signed by yourself and anyone else that's going to have to make some changes on the team. So you have your work plan, you start making those changes, you really implement some of these strategies. The step that you never want to forget is the reassessment. Maybe you reassess in a month, 3 months, 6 months down the line, but you need a reassessment point along with your manager to be able to say to yourself, what is working well? What could be improved here? Are there any more changes that have happened since I implemented my new working schedule or my new work plan? You also want to, at that point, again, start looking at any potential risks that could develop that you're starting to see. So maybe that means that you're not going to be able to make some of those really important meetings, and you want to make sure that your voice is heard. Or, maybe some of your coworkers are starting to feel a little overwhelmed. You want to think about those relationships as well, right? And then how is this impacting you at home? Is it helping you with your caregiving responsibilities, or are you still feeling really stretched? At that point, it's a good chance to talk it out with your manager and really think through some other strategies that could be put into place in case something isn't working. And I will, a little bit later, get into some real case examples of what that looks like on the ground. Before I continue, though, I just want to stop to see if there's any burning questions out there. We do have time later for questions, but if you do have a question or comment that you want to put in the chat, please feel free. Just want to do a check-in before I continue.
And so at the moment, there are no comments in the chat, and I will let you know if something does pop up.
Thank you so much, Amy. Okay, so now we've kind of talked through some of the strategies and tips that we've got put together for working caregivers, what you can do on your end. But we also do a lot of work with employers as well, because we need both sides, right? We need to make sure that we're providing the right tools and resources to employers so they can be ready for you when you have that conversation, or if they're noticing something has shifted, something has changed, how to have the right supportive conversations, right? So we've also developed a guide for employers, so for managers, leadership, and HR professionals. So that way they can also have the right tools ready for you. It's very similar to the toolkit for working caregivers, except speaking from that employer perspective. Even the tools are mirrors of each other. So if you have something where you're looking through the assessment, right? So we went through that checklist of things that could be helpful. We have a very similar resource, the assess and reassess for employers. Now, in a perfect world, you would go to your manager and say, I need to have this conversation. I'm a caregiver and I have some ideas of how I can make things better and find better balance. And then they could have their guide too, and hopefully have done a training of some kind and have some awareness of this to be able to say, okay, let's do this together. That's in the perfect world. We're not there yet, of course, but we're working on it. So we definitely focus on building more caregiver inclusive workplaces. A lot of employers are coming to us on their own because they want to find the best ways possible to ensure that they're thinking about their employee well-being. And that can mean so many different things. So this is really nice to see things moving in this direction. We also have e-learning geared to managers and HR professionals. So it kind of takes some of our practices from the guide and it turns it into an e-learning module for them, because everyone has different ways of learning, and we provide that opportunity. And then we do some tailored training sessions. So sometimes those sessions look like what we're doing today, only in a workplace for the employees, or it could be geared to the managers themselves. And we also find that the HR human resource professionals are working alongside us too to make sure that we've got the right language and that we're really thinking about the pain points for them as well. So now that you have a sense of what we have available to you when it comes to balancing work and caregiving and some of the strategies that we've been able to work through today, I want to give a couple of examples. So we've been fortunate enough, like I said before, to work alongside caregivers to develop all of these resources. And we have a couple of examples of people who have tried implementing some of these strategies. And so I'm going to go through that now. I'm going to start with Linda. So Linda is caring for her son living with an intellectual disability. She works at a very large corporation. And what she was finding was that between appointments and some of the changes that happened for her son in regards to his support, so he is now an adult. When he was a child, he was able to access a lot more services, but now she's having a hard time finding the right services to either come into the home. You know, during the pandemic, it was really hard to find more social opportunities for her son. So definitely she was feeling a little more overwhelmed as a caregiver over the last couple of years, especially as he's transitioning into more adult services, and there's a lot of change there. So she was able to go to her employer and think through, okay, you know, this is what I'm responsible for in our workplace. These are some things that I think I could maybe share some responsibility. If I could do flexible hours, that would be really helpful, because then I don't have to worry about leaving my Zoom meeting or an in-person meeting and running to an appointment across the city. So luckily, within this type of sector, Linda was able to implement some flexible hours. And that meant that sometimes she would leave work, whether it's virtual or in person, she would leave maybe, you know, mid-afternoon. And then later in the evening, when things had slowed down, she could sign on and continue some work later on in the day. And that was something that was understood and that was agreed upon within the workplace. Now, they did run into a little bit of a stumbling block on this. And so it's really good to know, you know, when things go wrong sometimes, like, what did you do next? So during the reassessment that they had scheduled, they figured out that one of the meetings that was really important for Linda to be at was kind of outside of her flexible hours times. So she was consistently missing these meetings that she really needed and wanted to be a part of. And again, like, when you start missing some of those things, your voice isn't always going to be heard, or the needs within your role aren't going to be heard by the team. So what she was able to do alongside her manager was also prepare for those meetings and then have one of her coworkers present her information that she would normally share at that meeting. They also made it so once a month they had a different meeting time. So they were able to make some accommodations together as a team that worked really well. Now I want to get into another example in a different sector. So we have Stephen, and Stephen is caring for his dad who is living with memory loss. And Stephen works in retail. He has all different types of shifts. This is not the type of job that you can do working from home, as we all know. And so what was difficult for Stephen was that because of the memory loss with his father, it could get hard sometimes getting certain phone calls throughout the day. Sometimes services didn't always align the way that they had hoped. So if a personal support worker was coming into the home while Stephen was at work, if something happened and they had to cancel, or their shift changed, whatever that looks like, maybe it was a different personal support worker coming in and his father would get a little nervous because he didn't know who that person was. He would have to field all of these phone calls, which is really difficult to do when you're working in a customer service facing environment. Also, there were some new appointments coming up that Stephen had to be prepared to take his father to. And sometimes too, like in the home, there are some challenges with basic needs like cooking or anything else that needs to be done around the home. And sometimes he would have to run out and assist his dad with that. So what happened here is he wanted to continue working. It was really important to him, and especially financially, but then also didn't have a lot of extra cash to bring in more paid support for his dad. So luckily, alongside management, they were able to work out a split shift scenario. So knowing that in the morning, if he went in for a shift, he could actually cut that in half of what it normally would be, and then split the shift with another coworker and come back later to finish it off, or split it over the course of a few days. So they were able to work that out within their team. Luckily, there was someone on the team. It was shared with us that that person was happy to take extra hours. They were doing a PhD or something along those lines, so they had a little flexibility. So again, it may not always work out so well, but that was something that worked out really well for this particular caregiver in a different type of environment. So hopefully that gives you a bit of a sense of how you can shift some things in the workplace, depending on the sector, depending on what's available on the team. And sometimes you really do need to do that reassessment. If it didn't work out, maybe try a different strategy, see how that goes. But it's definitely worth a try and worth the conversation, right? I also, earlier we mentioned that we do work alongside caregivers for all of this, right? So we are so lucky to have amazing caregivers who are in the workforce in our supporting working caregiver action group. This is a newer group that we established. We have a number of different working groups that come up based on what we're working on. And so this group is working caregivers in various sectors. And there's also a couple of members who are also in management roles or human resource roles. So it's really nice because they're able to see both sides of it. And we are currently recruiting for other caregivers and employers as well. So if you are interested or someone you know might be interested, we can definitely talk about that later. But just to give you a sense of how we pull all of this together, this group is really focused on building a better understanding of the working caregiver role throughout our society and how employers can support as well. And they really do help us create new resources and shape strategies for both caregivers and employees. The other part of this group is making sure that people know about it, because that's always a really hard thing to do. Get people connected and really promote all of these resources and the opportunities like today. So that's what that group is focused on. And like I said, if you have any questions, I'm happy to field those after today. So we just threw out a lot of information there. We worked through some strategies, some examples. Let's just do a check-in for a moment. And this is part of that reassessment too. So we talked about reassessment in the workplace, but also every once in a while, you want to do a check-in with yourself. How are you actually feeling? What about your well-being? And have you taken time for you this week? And so you can reflect on this on your own. You can share if you want to. It's totally up to you. But I think it's nice just to take a moment, take a breath, and kind of check in. We're coming near the end of the week. I don't know what that means for all of you, but for some, maybe you have a weekend off work, maybe you don't. What is something that you can do for you? And I see that there's a question, so this is a good time to kind of pause for that. So the question is, how can you take care of someone who needs 24/7 care and having to keep your job and dealing with other domestic chores? That's exactly the issue, isn't it? When someone needs constant care, if you don't have the extra support externally, so a personal support worker, nurses, someone, a social worker, anyone that can come in and assist with that, this is one of those major issues that people are running into. So at this point, who do you have around you in your personal circle? Who do you have around you professionally, or services that you can access? You can't, there's no way that you can run on a 24-hour clock and work and be a caregiver. It's not humanly possible. So at this stage, you need to kind of take a step back to say, what's going to be the best strategy for me? Is there an option for care to come into the home? I'm sure you've already looked into that, but are there other opportunities in your community that you haven't found yet? It's not always just through home and community care or your local health integration network. There could be other resources out there for you as well. There can be various tax credits that can help support that, other funding to look into, because in this case, you need to tap into support. Maybe it's a family friend or a family member or a neighbor, someone that can give you a little bit of respite or relief. The other thing is, a lot of our community programs are starting up again. So a day program of some kind, any type of activity that you could bring your care recipient to again, to give you some time. And then I don't know what sector you work in, but do you like working from home? Is that an opportunity for you within your sector? Just to see if you can maybe find some flexibility there with the hours as well. So we've talked about the strategies, we've got some background information, some ideas of the tools that are out there to support you. Now we're going to be taking some time to look through all of the different resources and supports that we have to offer you. And this continues to build, right? So earlier, Shrid showed us that diagram, kind of breaks down everything that we do at OCO. So this part is the caregiver and public information piece, okay? So public information that's available out there to everybody. Our website is designed so that way caregivers can find their tab, caregiver, and go through everything that's there for them. Providers, general information is there, resource and education opportunities are there as well. So our website's here. We also had to, we were happy to develop a Young Caregivers Connect website. So our main website really is the one-stop shop, but a lot of younger caregivers, so those under the age of like 25, were coming forward, and they shared with us that they weren't really finding anything for them within our main website, right? It wasn't really speaking to them and their needs and their experiences. So we were able to work with them to create another website within that's specific to their needs as young caregivers. So that's available as well. We do have monthly e-newsletters that are dedicated to caregivers and their needs and the new resources or various opportunities that are coming up. And we have quarterly e-bulletins for care providers. So we have talked a lot about employers and working caregivers, but in your personal life, you've got a lot of relationships there with medical professionals or anyone else that's helping to care for your care recipient, right? For your family member, for your friend. So we also make sure that we provide information to them on how they can ensure that you as a caregiver could be a part of that team. So those e-bulletins really help us to push that information out and to collaborate. And then of course we have social media. We're on everything, Facebook, Instagram, you name it, we've got a page. So we push out a lot of information through that as well. And that really helps us to generate awareness for those who may not understand what caregiving is. Maybe they've never had a personal experience, and to make sure that they're aware as well. The I Am a Caregiver Toolkit, we were very fortunate to have the opportunity for this to go out all across the province last month in newspapers. So you may have seen it. And what this does is break down information for both new and experienced caregivers. As we know, that can look very different. If you've been caregiving for a really long time, you might feel like you've already tapped into absolutely everything that you can, right? So we want to make sure that we have content and resources that are there for you too, and speaking to your needs as someone who's been caregiving for a long time, but also for someone who's brand new to caregiving. Sometimes it happens overnight. You know, there's an accident, there's an illness, something really difficult, really challenging, and now you're a caregiver. What do you do? Where do you start? So we have a number of worksheets to help build your care team, a self-assessment for coping, and some other resources that we have available. I mentioned our website. So these are the types of things that you can find on there. We also do make things available in print whenever we can, because we do acknowledge that not everyone is able to use the internet, join things like this evening, or get onto a website, right? So we do our best to make sure that people can find some of this information in other locations that they're already going to. But we have tip sheets, we have things for very specific diagnoses, and we definitely work alongside other organizations who offer services for very specific conditions across the community. And we have other resources for various groups, including 2S LGBTQ+. And again, all of these things are developed alongside caregivers within those groups. We have podcasts and various events that we offer as well. So speaking of podcasts, I have a little note here because I want to tell you about what's happening with that. Now, I know not everyone loves a podcast, but if you do, we do have this available. We're going into our second season, which is really exciting. And you can join our host, Michelle Jobin, and caregivers, as well as various subject matter experts. And what they do is take that time to work through various topics. So some of those topics include becoming a caregiver, keeping relationships strong, managing money, as well as health system navigation. And so, like I said, we're going to season 2. They're all available on anywhere that you listen to podcasts, such as Spotify or anything else that you use. You can find it on any of those platforms. So the other aspect of what we do is that direct to caregiver program and service. So this is where we focus on caregiver well-being, looking at the needs and the pain points that caregivers share with us through our Spotlight report and through a lot of our programming. We look at those needs and then we find resources, or if the resources don't exist, then we develop those resources to assist with those needs, right? So thinking about advanced care planning, caregiver skills and further development. What we've heard a lot is that when you become a caregiver, nobody's training you, nobody's really guiding you. You just have to figure it out. And that is really scary and really challenging. So we definitely want to make sure that we're going to be there for caregivers to really enhance some of those skills and build that when you do become a caregiver, or if you have been for quite some time. And we have a number of webinars. So we normally do one a month, sometimes 2, on these various topics where we bring in the caregiver experience, we bring in those subject matter experts in that platform as well. We also record all of them, and they're always available on our OCO website or through YouTube. The other side of this is e-learning. So I spoke earlier about e-learning that's available for employers, but we also have e-learning for caregivers like yourself or for professionals working alongside caregivers and taking care of their care recipients. So just some examples. So if you are the type of person that, maybe I don't want to join a webinar, but I like to do some learning on my own if I have an opportunity, maybe, an hour to sit down and go through some modules. Sometimes people really enjoy learning like that. So here's some ideas of what we have: Caregiver 101, Roadmap to Care for mental health and addictions, or just some examples of what we have available there. And everyone gets a little certificate at the end when you complete it. And just a reminder, this is all free. So anything that we offer, our services, our resources, they're all free. They are all available in French and English. And we also have our helpline. So maybe you're thinking right now, well, this is all well and good, but I don't even know where to start. This is just a lot of information flying at me, and I'm going to have to think through this. In this case, we have our Caregiver Helpline. And so this is supposed to be that one stop. If you are thinking, okay, I kind of know what my needs are. Again, I don't even know where to begin here. We do have phone support available 24/7. We have specialists that are trained to support caregivers. And we have a live chat through our website as well that's available Monday to Friday from 7 a.m. to 9 p.m. So This is an opportunity to find more information on some specific needs that you have. And if you're looking for services for yourself or for the person that you care for, they can also refer you to some other options, whether that's internally to OCO, they can register you in our internal programs and services on the line, or they might refer you to an organization locally. They're doing the legwork of searching for all of this in those moments. So like I said, our service is available French and English, but for the helpline, there's other languages there too, where there's an interpretation service available. So if you are speaking another language, then they do that free of charge. It's a confidential service, but it's also really important to note that this is not a crisis line. Now, if someone did call in crisis, there is an opportunity to do a warm transfer to a crisis service or to dispatch to 911 if that was required. But they're here really to talk through what's happening, what are the needs, and then match you to the most appropriate services and supports available. Now, we like to make sure that that's locally in your community, because you definitely want to make sure that people are getting something close to home. Or if it's a very specific condition, such as dementia, we're going to make sure you're referred into your local Alzheimer's Society. However, sometimes those services don't exist in your community. So that's really where we come in with some of what we offer as well. So at this point, I'm going to pass it back over to Shrid. He's going to tell us a little bit more, and then we're going to get to the chat there. Thank you.
Awesome. Thank you so much, Felicia. If you don't mind, can you go back to the e-learning slide, please? Awesome. Yeah. So I just, Felicia talked about it, but I just wanted to kind of talk a little bit around the Caregivers Partnering with Health Professionals course. So a lot of caregivers provided feedback saying that, you know, when they went into a doctor's visit, for example, they did not know how to put across what they were going through, or maybe the healthcare professional was not really taking into consideration what they had to say around what the care recipient was experiencing. So this course is really a way for to kind of get some insight into how you can effectively have communications with healthcare providers, with a physician, with your family doctor, with maybe the ER doctor, around what the care recipient is experiencing, and maybe also take a moment to express what you might be going through as a caregiver as well. So if you've had an experience or continue to have an experience around maybe some challenges around having effective communications with the care professional, the care provider, the physician, the doctor, the nurse, whoever it may be, then I would really encourage you to take a look at that course and find ways in how you can kind of start the conversation with your care provider around your well-being, and as well as provide more insight into the care for the care recipient. Thank you. So next, I think 2 slides. Awesome, the SCALE program. So the SCALE program stands for, and let me see if I remember, support for caregiver awareness, learning, and empowerment. There you go. Right. So this is an 8-week program that's built around giving the caregivers skills to take care of their own mental health and well-being and build resiliency. So these are 8 psychoeducational webinars. So it's a weekly program that we run twice a year, once in the spring, once in the fall. And what's unique about this program is that caregivers can opt to sign up for any particular week or all 8 weeks if they like. Really, if they want to really do more of a deep dive into, say, week 6, how caregivers can overcome anxiety and anger, they can really register for that one particular week and participate in that webinar. And followed by the webinar, if they want to have more discussions and if they feel that they need additional supports, they can sign up for the individual counseling session or the group counseling session, and which is there's a screening process where the facilitator will see what is a better fit for you and then offer that to you as well. The program is run by a partner organization, a third-party organization, and is run by a registered social worker and a registered nurse as well. Our next cycle for this program is going to start, I believe, in September, towards the end of September. But the most recent iteration of this program is always recorded and is available through our YouTube channel. So if you want to go and check out these topics, you can go to the YouTube channel and find this there as well. Next slide, please. So we also run some peer support groups at OCO. So these peer support groups were more for an offset to those support groups that were not accessible during the pandemic. So there were a lot of caregivers who said that they were maybe attending one-off sessions in their community hubs, their local library, or maybe their faith-based centers. And because of the pandemic and all the restrictions, all of these options suddenly became inaccessible to them. So we started these virtual peer-based support groups to get caregivers to find space to kind of talk about what they're going through, and also talk about the different things that they're experiencing emotionally, and maybe also find more meaningful and long-term supports that are more relevant to what they're going through as well. We have support groups continually throughout the week, different times during the day, and we have a young caregiver support group that runs, I think, every Wednesday from 7:30 to 8:30 p.m. That's specifically for young caregivers between the age of 15 and 25. Again, because young caregivers, Felicia mentioned this a little bit early, said that they were not really resonating with some of the discussions and the conversations that were happening in these larger support groups. So they wanted to have space where they could meet with other young caregivers and see what their experiences were like. You can go to that register here link, which will take you to the webpage to register for any of our available support groups as well. For a more personal one-on-one approach, we have the one-to-one peer support program. So for a lot of caregivers, we heard feedback saying that they really wanted to speak to another person who's kind of gone through a similar situation or is experienced in a particular type of caregiving. So we started the one-to-one peer support program where an experienced caregiver signs up to be a peer mentor through OCO, and they are provided peer mentorship training through OCO on how to be a peer mentor, and they're matched with a caregiver who needs a more extensive one-to-one emotional support. We ask that when they do sign up to be a peer mentor, that they sign up for at least a year. Most of the time, these relationships last about 6 to 7 months. And on the face of it, this program is built as a telephone-based program where the peer mentor and the caregiver kind of find time to connect over the phone. But really, once the peer mentor and the caregiver build their own rapport and build trust as part of this program, we leave it to them to really define the terms of the relationship. And if they want to meet in a virtual setting like this, they're more than happy to do so as well. Next slide, please. We mentioned the Young Caregivers program. So the Young Caregiversconnect Ca is a website for young caregivers between the age of 15 and 25. Now, it's not that if a 14-year-old or 26-year-old wants to join, we say no. It's really on a case-by-case situational basis. But the content for this website and the forums that are run on this website are all peer-driven. That means we have young caregivers who are peer mentors through OCO who help us run the forums. And it's really a safe space for young caregivers to come together and talk about what they're experiencing and be able to share what they're experiencing and get and find other social connections and other young caregivers who might be able to help them through their journey as well. So if you know a young caregiver, please feel free to direct them to our website, the youngcaregiver.ca website, and they'll be able to access all of the content on there. We also work across the system with different partners and stakeholders. We work at a municipal level, at a regional level, as well, provincial level, and we work with various agencies from public health units to home and community care support agencies to Ontario health teams, and system partners such as Scarborough Centre for Healthy Communities. So we offer learning and education opportunities for staff at different agencies around how to engage with caregivers, for example, and how to co-design strategies with caregivers, and how to make sure that they are supporting caregivers. We offer tools and resources to system partners around how they can take steps at their workplace to make sure that they are engaging caregivers when they come to the door. For a lot of agencies who have reached out to us, they say, I really don't know how to recognize who's a caregiver and who's not, or if they're a caregiver, it might seem rude to say, hey, do you need any help? So how do I start that conversation? So we have different tools available for care providers to start that conversation. We also collaborate on different initiatives with partners. For example, Felicia mentioned our podcast, so we invite different agencies to be subject matter experts in our podcast. If an agency says, you know what, I have a lot of caregivers who would like to be peer mentors, or I have a lot of caregivers who want peer mentorship, then we can really partner with them to say, hey, let's see how we can initiate a peer mentorship program, one-to-one peer mentorship program at your agency, while we also help with the training piece, for example, for the peer mentor. So we work across the board with system partners, with stakeholders throughout the province. One of the things that we offer them is our Care Provider Resource Center, which has tons of tools on how to meaningfully engage and co-design strategies for caregivers. And this could be for the caregiver's well-being and also for to be able to better take care of the care recipient as well. Like I said, we work with Ontario Health teams, and we have a toolkit around including caregivers as part of the care team as well, that's embedded within this resource center for care providers. Next slide, please. One of the toolkits that we have for care providers is the Time to Talk toolkit. So going back to what I mentioned around care providers not really knowing how to start the conversations with caregivers and how to meaningfully engage with them. So this toolkit has different resources, including a tip sheet that really helps them identify ways to recognize and engage and support caregivers. So it's not enough to just recognize and engage with them, but what do you do after you recognize them, and after you engage with them, how do you assist them, and how do you point them towards the direction or offer them supports and services that are most relevant to their needs as well. It also includes learning videos that agencies can access. And if there's an agency that comes to us and says, hey, you know what, we really like this toolkit and we want to be able to broadly offer this across the board in our organization, we help design workshops with agencies to make sure that they understand the content and are able to offer this service to their clients as well. Next slide, please. We all know how complex Ontario's privacy and consent documents are. So what we've done is we've taken those resources and really put them down in layman's terms, in really simple terms, so that everyone can understand what privacy and consent obligations there are on the part of the care provider, as well as from the caregiver standpoint as well. So you can go and check out our suite of resources. We have tons of resources for caregivers and care providers around understanding health privacy in Ontario, understanding health privacy and what it means to be a caregiver, what does privacy and consent look for caregivers of children and youth, and a range of different resources as well. Next slide, please. And then we continually also engage with caregivers throughout the province. And Felicia mentioned this earlier on as well. We have different working groups like our mental health working group and our working caregivers working group as well. We have our advisory panel, as well as different opportunities where caregivers can provide insight and feedback into the work that is being done at OCO and also at other system partners as well. So most recently, next slide please, we launched our Caregiver Voices platform. So the Caregiver Voices platform is a way for caregivers to provide feedback and insight into everything that's happening caregiver related across the province. So if there is a toolkit, for example, that we're developing at OCO, we really want to hear from the caregiver to make sure that we're addressing those pain points that Felicia talked about, and we're addressing those gaps in service and gaps in and needs that are identified through the Spotlight report, for example. So once we develop the resource, we put it onto the platform so that caregivers can look at the resource and say, hey, you know what, this language works, this language doesn't work, or maybe we can add this or take this out, and really help tailor that resource to those needs and gaps that caregivers identify. And then we also have one-off opportunities that we continually get asked by system partners around different research opportunities that are happening throughout the province. We make sure that this is also put on the Caregiver Voices platform. We recently had one around focus group around looking at national service standards for long-term care. So based on what the government saw during the pandemic, they wanted to get a sense of what caregivers experienced throughout the province when it came to their engagement within long-term care setting. So we did a focus group with different care providers and with caregivers throughout the province to see what their experiences were, so that we can filter that up to the federal level, so that they can create more policies that are more friendly for caregivers to have interactions in long-term care settings, for example. So you can, next slide, please. You can go on to our website, which is the caregivervoices.ca, which is a sister website as well. And you can, this website is available in both English and French, and you can create a username and a password. And once you do that, once you register, you can sign up for email notifications based on your interests, and you will get notified on the various opportunities that come up through the platform. And then you can sign on there and provide feedback continually as well. And then if you want to be more active and kind of participate on a more regular basis, then please feel free to reach out to either Felicia or myself, and we'll be happy to connect you with our caregiver lead, engagement lead, who can continually provide you with different opportunities that may come up. Or if you want to be part of the advisory panel, for example, then that's how you can get in touch with us as well. Next slide, please. And we continually also will work to raise public awareness on the value that caregivers bring to our healthcare system. So we know that when we're looking at it from an economic standpoint on a federal level, caregivers, depending on where they are, contribute to about $26 to $75 billion per year in healthcare funding, right? So, healthcare expenses. So that really means that without our caregivers, our healthcare system would collapse, and we would not be able to support care recipients. So we do a lot of public awareness campaigns through announcements, advertisements. You may have seen them in the TTC to kind of inform the general public around who caregivers are, what they're doing, and what value they bring, and why is it important for us to be supporting them continually as well. And next slide, please. We also, Felicia mentioned this earlier on, we have our newsletter that you can go onto our website, ontariocaregiver.ca/subscribe to sign up for our monthly newsletter. And if you're a care professional, then you can access our e-bulletin as well through that link, and be in the know-how on all the different things caregiver related that are happening across the province. My email, shriddi@ontariocaregiver.ca, and Felicia's email, felicia.h@ontariocaregiver.ca, is available on the slide deck. Please feel free to reach out to us if you have any questions 4 days, 5 days, a month down the line that you may not think of at this time. Thank you so much. Any questions for either Felicia or myself, or just in general?
Just before we go into the question period, I just want to thank you so much for all of that information. I'm also now going to stop the recording and we can dive into some Q&A.